The articulating surfaces of synovial joints contact each other and determine the amount and the type of movement. So we often hear people talk about range of motion of a particular joint. So that simply refers to the range measured in degrees of a circle that the particular bones of that joint can be moved. So there are several things that contribute to range of motion. The first, of course, should make sense, the shape and the structure of the bones that articulate together. So the way those bones fit together, how tightly or how loosely they fit together, what their articulating surfaces look like. So the articulating surfaces of some bones have a very complementary relationship. So think about the femur. The femur, of course, has that large head that sits in the cup known as the acetabulum of the hip bone. Okay, so putting that head in a cup-like structure allows for an interlocking fit that allows rotational movement. So a good bit of range of motion there. If you think about the structures of the elbow joint, the ulna has that little grooved notch that sits around the distal end of the humerus. So it prevents a certain movement, such as hyperextension of the elbow joint, because again of the way the bones fit together. The strength and the tension of the joint ligaments that make up the joint, the fibrous joint capsule, can also affect range of motion. So really tense ligaments restrict the range of motion, but also direct the movement of the bones in respect to each other. For example, in the knee joint, the ACL or anterior cruciate ligament is tight or tense, and the posterior cruciate ligament is loose when the knee is straightened, and the reverse occurs when the knee is bent. So the way that those ligaments of the joint can change their tightness or their tautness will change the way that joint can move. The arrangement and the tension of the muscles that are attached to the bones that help to reinforce or strengthen that joint, of course, are also going to affect how that particular joint can move. A good example of the effect of muscle tension on a joint is at the hip joint. When the thigh is flexed and the knee is extended, the flexion of the hip is restricted by the tension of the hamstring muscles on the thigh. Most of us can't raise a straightened leg more than about 90 degrees from the floor. But if you flex your knee, the tension of the hamstring muscles is lessened, so the thigh can be raised further, and allowing you to raise your thigh to touch your chest. Yeah, I'll pause. I know some of you are trying this right now. Okay, so the contact of the soft parts. So the point at which one body surface contacts another may limit mobility. For example, if you bend your arm at the elbow, it can't move farther than the anterior surface of the forearm where it meets and presses against the biceps brachii. Yeah, soft parts are going to constrict your movement as well. You can't move beyond another body structure. So joint movement can also be restricted by the presence of adipose tissue. So anywhere that you have excess adipose tissue, it may restrict how far you can flex or move that particular joint. Joint flexibility can be affected by hormones. For example, there's a hormone called relaxin that's produced by the placenta and the ovaries. It increases the flexibility of the fibrocartilaginous pad, remember that's the pubic symphysis, and loosens the ligaments between the sacrum, the hip bone, and the coccyx near the end of pregnancy. So these changes allow for the joints to become more flexible and increases the expansion of the pelvic outlet and allows for delivery to happen more easily. And then there's just disuse. We don't take care of things as we should. So movement at a joint can be restricted if a joint has not been used for an extended period of time. For instance, if an elbow joint is immobilized by a cast, range of motion at the joint may be limited for a while after that cast is removed. Disuse can also result in decreased amounts of synovial fluid. decreased flexibility of the ligaments and the tendons, and muscle atrophy or wasting away in the reduction in size of the muscle. All of this is going to limit how much that particular joint can move. All right, and then there's aging. As we age, we tend to lose synovial fluid in the joints. In addition to that, the articular cartilage becomes thinner. The ligaments shorten and lose some of their flexibility. The effects on aging on the joints can be determined by genetic factors, but also by wear and tear, how much we use those joints. So this varies from person to person. Most degenerative changes in joints may begin as early as in the 20s, but we don't start noticing them until we get older, much later in most people. So by about 80, almost everyone develops some type of degenerative disease or degeneration in the knees, the elbows, the hips, the shoulders. Think about it. Those are the joints that we move and use most often. So it's common for elderly to develop degenerative changes in the vertebral column as well. So the vertebrae, the joints within the vertebrae begin to change, and you lose some of the fluids in those intervertebral discs. So sometimes the elderly will lose height and also develop a hunched over posture, and that can cause pressure on the roots of some of the nerves. Also, there's a type of arthritis called osteoarthritis that is at least partially age-related. So nearly everyone over the age of 70 has some evidence of osteoarthritis. The good news is stretching, aerobic exercises, and things that help us to maintain full range of motion are really helpful in minimizing the effect of aging. Why? Because they help us to maintain effective functioning of the tendons, the ligaments, the muscles, the synovial fluid, and all that articular cartilage. Now, it's not uncommon as we age to just simply have some of these joints that wear out completely, and we need joint replacement. One of the more common types of joint replacement in the elderly is replacement of the hip. So joints that have been severely damaged by disease like arthritis or injury may have to be replaced surgically with artificial joints. This is known as arthroplasty. So if repair can't happen, replacement may need to. About 400,000 hip replacements and about 300,000 knee replacements are performed every year in the United States. So here, I'm not going to go into great detail on this, but here you can see the normal structure of the shaft of the femur and the head of the femur sitting in the acetabulum of the coxal or hip bone. And when this joint is damaged beyond repair, then pieces of these bones may be removed and replaced with an artificial component so that the movement or use of that joint can be restored. Same thing with the knee joint. This is pretty common. When knee replacement, a total knee replacement is needed, they go in and they grind off some of the damaged surface of the femur and the tibia. The patella is usually removed as well, and then artificial components are put in to restore function of that joint. Here you can see an x-ray or radiograph of a total knee replacement. Now, sometimes just a partial knee replacement may work, just depends on the severity of the damage of that particular joint. And then we'll talk about a few additional disorders related to joints. There are numerous disorders associated with joints. I mean, think about it, we're constantly moving the human body. Osteoarthritis is a degenerative joint disease in which the joint cartilage is lost. So it gradually just wears away and it's not replaced. This results from a combination of aging, obesity, irritation of the joint, muscle weakness, wear and tear, abrasion. This is commonly what most often is just the wear and tear arthritis. It's the most common type of arthritis and commonly formed in the weight-bearing joints. So the articular cartilage degenerates, new bone may form in that area, and you end up with a lot of friction where that cartilage is missing, so a lot of painful moving of bone against bone, and it becomes very painful to use those joints. Rheumatoid arthritis, on the other hand, is an autoimmune disorder or disease in which the immune system of the body attacks its own tissues. In this case, the immune system is attacking the cartilage and the joint linings. RA, or rheumatoid arthritis, is characterized by inflammation of the joint. That's going to cause swelling, pain, and loss of function. So rheumatoid arthritis is autoimmune, where osteoarthritis is just we're getting old and joints are wearing out. Lyme disease is caused by a bacteria, and it's named by where it was first reported back in 1975 in Lyme, Connecticut. It's transmitted by bacteria, usually by deer ticks. So the bacteria infects the ticks get on the humans. These ticks are very, very small, and their bites typically go unnoticed. But within a few weeks of a bite, a rash tends to appear at the site of that bite. A lot of times the rash will sort of have the appearance of a bullseye target. But now there are variations, so don't think just because there's not a bullseye it's not Lyme disease. But then again, not every tick bite will cause Lyme disease. It just depends if the tick is carrying that particular bacteria. So most people develop the rash, joint stiffness, fever, chills, headache, stiff neck, nausea, back pain. Man, it's just, a whole lot of things going on here. In the advanced stages, the arthritis, though, is the main component. So it starts to create those very, very painful joints. Usually affects the larger joints as well, such as the knee, the hip, the ankle, the elbow, the wrist. And antibiotics are generally going to be effective against Lyme disease, especially if they're given very early in the infection. Sprains and strains are very common. Again, we're using joints, we're moving around a lot. A sprain is the forcible wrenching or twisting of a joint that stretches and tears its ligaments but doesn't dislocate the bones. So it occurs when the ligaments are stressed beyond their normal capacity. Severe sprains may be so painful that the joint can't be moved and it has to be immobilized or wrapped. A lot of times there's a lot of swelling in this area as damaged cells release blood and immune system cells and fluids into that area. A strain, on the other hand, is a stretch or partially torn muscle or muscle and its tendon. It often occurs when a muscle contracts suddenly and really powerfully, such as the leg muscles of sprinters when they spring from their starting blocks as they're running. Initially, sprains are typically going to be treated with price, protection, rest, ice, compression, elevation. So let's think about what those are. Protection simply means you protect from further damage, right? So get off the ankle if it has a strain. Rest, again, stop what you're doing. Rest is needed for repair. So avoid the exercise or other activities that put more pressure on that particular joint. Ice on the injured area as soon as possible. Ice slows down blood flow to an area, and as it does so, it reduces swelling and relieves pain. Usually works effectively if you apply it for about 20 minutes, take it off for 30, 45 minutes, put it back on for 20, and alternate back and forth. Compression, use a bandage or a wrap to help reduce swelling. Of course, you want to be sure when you're applying compression that you are not blocking blood flow to an area. And then elevation. Put the injured area above the level of the heart to reduce blood flow and also to help reduce potential swelling. So price, protect, rest, ice, compression, elevation. All right, another disorder associated with joints, Tenosynovitis, is an inflammation of the tendons or the tendon sheaths or even the synovial membranes surrounding certain joints. A lot of the time this is going to develop in the wrists, the shoulders, the elbows, finger joints. So these things, again, joints that we're constantly using. The sheaths may become very visibly swollen as fluid accumulates. Tenderness and pain are associated with it. This type of disorder may develop in where you have repetitive motion. So someone that is typing or carpenters or assembly line work, where for hours at a time you are doing a repetitive motion over and over and over and over. And last, we'll look at a dislocated mandible. The mandible is your lower jawbone. It creates your temporomandibular joint, where the mandible sits in a little fossa on the temporal bone of the skull. So it can become dislocated in several ways. Common causes may surprise you: yawning, opening your mouth extremely wide if you're taking a large bite of something, dental procedures, or it could be a blow to the chin. You're playing baseball and the ball hits you, a bat hits you, or you're doing something and you end up falling and you hit your jaw. So whatever the cause, you're having a blow against that mandible, and the upper part of that mandible, the process that sits in the temporal bone, can slip out of that joint. So typical treatment: move it back in place.